All right, today we're going to start off talking about chapter 3, and honestly, I might go ahead and zoom right on through chapter 4, and y'all, hang in there with me because there's reason behind it. The more of this, there's a good many chapters we got to get through. The more of them we can plow through early, the more hands-on fun stuff we'll get to do as far as being able to participate ourselves. So if I can run through both of them, that's probably what I'm going to do. I'll share this screen real fast for anyone who's not here. Another thing, I'm doing this whole Zoom thing because I've got somebody that absolutely cannot be here right now. Once that happens, it's not going to be something that I want to do every time if I can help it. It's a pretty convoluted way to try to teach. So also it gives y'all a good reason to say, hey, I can't be there. How about recording it and sending me the copy? So I don't really want to get into that. So reason I pulled up this page right here is I want you guys to look and just kind of read over this. If this is the first thing on the syllabus where we're going to, what I'll do is I will probably, and I'm not going to do it today, but we will do like a hypothetical case study. Those of you who are in my second class, I will give you one, and we'll do one here in class, and you can turn it in to me. We may even have some of you guys read what you wrote up as far as what would be some good techniques to use with the person given what I've told you about them. You know, Tammy is a 60-year-old female who had a stroke. She's affected on her right side. She enjoys socializing. One of her favorite games is cards. She has been homebound for the last 6 months, but would like to have more time with her peers. That's just a good example of kind of along the line. I got it recorded. We may use something just like that. And then I'll have you guys write up, okay, what should we do with her using recreation therapy skills? So basically, what I'm going to want you to do is tell me what you're addressing, what you're going to try to improve, and then give me justification of why you chose what you did. Again, not doing that today, but just kind of start thinking about that process. We'll have one of those, and then I'll probably post one on Blackboard for you to do like at home and turn in a second one just for practice, okay? So that's all on that. So let me share this again, and we'll go to chapter 3, I think that is. Hopefully it actually changes to that. Here's some more of my junk calls. Let me turn that off. I can't talk with it vibrating in my pocket. So chapter 3, if you looked at it, it was really short. Some of these chapters are not long at all. There's a good many chapters in the book, but they're not usually super long or super difficult things that we're going to go over. This one is all about selecting what we want to do as far as programs and activities based on goals and outcomes. And I'll decide in a few minutes whether I want to get more into goals and objectives, okay? But we want to always keep in mind that we're trying to produce client outcomes that follow the realm of things that we have knowledge in. If you don't know anything about ropes courses, you don't want to use a ropes course for your tool. You know, you'll go out there and get somebody hurt. So just an example of kind of staying in your lane as far as now, if that's something that you would love to do, there are opportunities for you to get out there and learn about how to provide ropes course instruction for your groups. And I think they're a lot of fun. However, I could not go out and do it myself either because I haven't been really trained in it either. You want to make your activities count. We're going to talk about how we choose what activities we're going to be doing, and then we'll talk a little bit about how to design activities and games for leisure education. So, some basic assumptions, and I've got some notes today that I wrote down, and I'm going to so I'll be back and forth here. When it says here, simple activity provision is no longer viable. Basically what that's saying is cafeteria style program, or here you go, y'all do this. Rolling out a ball and say, play basketball. That's not recreation therapy. That's not viable. You're not working on anything particular with everyone. You are, you're just tossing them a ball and say, do it. And you're just sitting there. Therefore, you're not doing recreation therapy. You may be providing recreation, but it's not therapeutic in nature. And that's the key that you got to remember. If you hold yourself to accountability, you will move your clients toward these essential outcomes, which you will. Where do we find out what outcomes we want to have? When do we come up with that? What's the 4 steps of recreation? Planning stage. Yep, absolutely. The planning stage is where you're going to plan what you hope to be the essential outcomes, the goals and objectives. You get that after doing your assessment, where you get your information that you're going to pull it from. So when it says TRS on these slides, Therapeutic Recreation Specialist, you need to continue to learn skills and face new directions. So basically, don't just get comfortable. I had a stage in my career when I was at NMRC that I got in a little bit of a rut, and I'm not going to lie, I had a little. My monthly calendar for the clients that I was working with was not very different from month to month. It was just the same stuff. And then I went to a conference and somebody talked about switching up what you do and giving them options and things. And I got kind of rejuvenated at that point and started doing what we're talking about, where I started trying to learn some new things that I could do with them, brainstorm some new ideas that fit a lot of the people that we had and the resources that were available that we had. And that's important too. I did a lot of things that dealt with aquatics and aquatic therapy because at NMRC we had a pool. Well, actually we had a deep pool, and then we had a shallow pool that was like 93, 94 degrees. And I don't know how many of you guys know about pool temperature, but Turner Center is their pool is probably about 82, 84 maybe. Ours is 10 degrees warmer. It's like bath water at the NMRC. But kind of gross, like for me, to feel like you get in it and you don't cool off. But for someone who's in a wheelchair, who's has severe contractures in their arms and legs, they're drawing up all the time. You get them in that warm water, they don't have the pressure of being these guys are either on a bed, in a wheelchair, some kind of pressure on their body all the time. You put them in that warm water where they're actually floating, they don't have that pressure on them, and then you can do some gentle stretches and have them do some, come on, let's race to the other side. And they couldn't move much, but they would try. By the end, let's just say at first their arm would bend this much. By the end, their arm would probably bend to here, and it would last a few days. It was pretty amazing, but that was a medium that we had available to us, was that pool. So we used that in a lot of different ways. So for those of you who've been in my other classes, we all know what modalities are, right? Tools or activities, whatever we use to try to get to these essential outcomes that are listed here. There's critical pathways. Those are generally listed out at the facility. They have a plan for critical pathways. And they say for clients with diabetes, this is the plan we would like to go. And you can stick as close to that as you can, but that's something that you will be given, not something that you would have to come up with. You need to have clinical competencies, which means you need to be aware of and you need to be versed in the population that you're going to be working with, basically. And performance measures. You need to have ways to validate whether or not they are receiving benefit from what you're offering them. So, again, making activities count. You need to have a set of knowledge and skill competencies which include, obviously, number one, the purpose of therapeutic recreation, not just recreation. Yes, when I was in recreation therapy department doing therapeutic recreation, there were times where we would take trips to the circus when it would come to Memphis or Jackson. Were we really working on a lot on that? No, it was mostly for fun. They got to go eat somewhere different on the trip that they don't usually get to. They got to see all kinds of things that they never see. But for a lot of the clients, we were actually working on loading and unloading into vehicles. We were working on staying with your assigned staff. We worked on getting up and down stairs, proper, like when they were eating, that they were actually using their forks and things properly. Now, that's not the primary things that recreation therapists are going to do, but we are doing some beneficial things even when you're doing something that's, quote, just for fun. And that's something that you need to be able to recognize as a recreation therapist too, is, you know, to pick out those things that, yeah, it looks like we're just taking them on a fun trip, but what are we actually, how are we helping them while they're having fun? You got to kind of think outside the box and think, because you need to document the things that you're helping them with. So there needs to be a purpose. It needs to be therapeutic. You're going to always base what you're doing on the client's needs. That's important. Where are their deficits? Where are their needs? You need to base what you're doing on client outcomes. And let's talk about each of these three things here. Causality, the definition of that is basically just saying that participation in what you're doing is going to produce an outcome, an expected outcome. You know, if you go outside without a jacket on today, you're going to get cold. Causality. Your participation in not wearing a jacket is going to make you get cold. Predictability. Just saying that you can, through knowledge that you've gained up front, through your own learning, through looking at models like we talked about before, studies in the past, predictability, it gives you that there is an outcome that's reasonably predicted from participation in what you're giving them. So if they participate in a walking program 3 days a week, we can expect to see improved cardiovascular endurance and perhaps weight loss, depending on how hard you're working with them. See where I'm going with that part. Third, replicability. That is, the outcome is likely to occur for all or at least most participants that go through this particular plan. So you need to kind of know what those three things are that have to deal with looking to meet client outcomes. Yeah, replicability, your outcome is likely to occur for all or at least most of your participants. I mean, you can't guarantee that it's going to, everyone's different. Everyone's going to put out different levels of effort and things like that. So it's going to, you can at least say that this outcome should be able to replicate based on what we've seen. You want to give them a variety of activities that they have a say in. Again, when they have a say, they buy into it. They're going to be far more involved in what you're offering them if they have actually had a say in what they're doing. Okay. Now, sometimes you have to step in and make some recommendations. You know, well, from what I see, it would really benefit you if we did something that worked on weight loss, for example. You know, and then you come up, so what are some things that you think, if I'm talking to the patient, what are some things that you think may help you that are going to be active enough to maybe help you lose a little weight and you still have fun while you're doing it? And if they throw some ideas out there that are great, then you can roll with those. And if they don't, then you have to finesse them into thinking that they thought of it by talking your way through it. And that sounds, I'm not trying to be shady when I say that. I'm saying that you have to sometimes use a little bit of coercion to get them to see the benefit in what you're trying to tell them. Facilitation techniques, that's just how's the activity delivered. You need to be able to tell them up front how it's going to be delivered. You need to be well versed yourself in how to deliver activities when you're giving them. You know, you're not feeling your way through it as you go. You know, you're not going to play a board game for the first time with a group and have to, all right, y'all hang on just a minute. I got to read these instructions. You need to do that ahead of time. There's a kind of what we're getting to with that. So some factors that are going to affect your activity selection, and these are going to be covered in the upcoming slides. Activity content and process, your client characteristics, you know, who are we dealing with, and what deficits are we dealing with, and resource factors. Like I said, that's what do we have available to us to use. So this one gets a lot on one slide, but activity content and process, your activities need to have direct relationship to the client's goal, one of their goals. You're not addressing everything that you're working on with one activity. If you are coming up with some really, really, really good stuff. If you can address 3 or 4 goals or objectives with one, you know, with one activity. Functional intervention activities need to focus on the ability of the activity to help the client reach their goal rather than just on doing an activity for activity's sake. And that goes back to like what we started at the first of the class where I said, we don't just roll out a ball and say, here, play ball. That's what we're doing today. You need to be doing an activity for a purpose. That's what therapeutic recreation is. Your functional intervention and leisure education activities should have predominant characteristics that are related to the problem, skill, or knowledge being addressed. So you need to stay on target, stay on task when you are working with leisure education activities. You're teaching them how to do something. You're educating them on something that they can do once they're out of your care, or ways hey, these are things you can do at home. This is easy. When you're doing that, you need to tell them why they're doing it as well. Now, when I say that, I don't want you to treat patients like they're too dumb to realize anything, but at the same time, you can look in someone's eyes and tell whether or not they're with you or not, or whether they're kind of confused of why you're asking them to do this when they get home. You see something like that, you need to share your why with them. Activity characteristics are important considerations for the successful implementation of a program. Clients need to be able to place an activity in some context in order for them to see it as useful and applicable to their rehabilitation or treatment outcomes. That's exactly what I just said a minute ago. They need to see the benefit in a context of, this is why I'm doing it. So when you're in the leisure education phase, that's where you're telling them why it's important and why they need to do this and how it's going to benefit them. So they need to be able to see that context. A single activity or session is not likely to produce a desired behavioral change. Okay? I mean, you think Michael Jordan or LeBron James walked in the gym the first time and hit every shot they were taking? Probably not. It took a few, took Tiger Woods a few practice swings before he got to where he was killing it. So, same thing. You can't expect miracles, especially if you're dealing with populations like, say, I was working with at NMRC, who had developmental disabilities. Therefore, they were on a lower mental age than they were in chronological age. So repetition was a big thing with them. When you did things multiple times, you would start to see them understand, and you wouldn't have to help them as much. You wouldn't have to give them as much instruction as you went more along in it. So don't expect a miracle the first time you ever do an activity. It's a cumulative effect that you're looking for that's going to help them be better. Consider the types of activities in which people will engage when they have choice. So that's something you're going to talk to your patients about. That's the thing that you talk about up front. What do you enjoy doing? If I wasn't asking you to do something, what would you do tonight when you went home? Ask them things like that. And try to find some things that fit kind of closely along with what they're talking about. Program to the client's outcomes and priorities. So where do they want to get? Where do you see them needing to get as a therapist? And where does the team see the need and the deficits that you're going to be working on? You want to program to that. And it says to the client's outcomes and priorities. So that goes back again to talking to your patients, talking to your clients, and finding out what they want to get out of recreation therapy. Again, back to NMRC, when I was there, I had a lot of nonverbal, non-speaking clients. Was I able to really get this from them? No. We would have meetings where their family would come in. We would find some information from family members. They would tell us things, well, when he was little, all he used to do was swim. Where he's not going to tell me that. I would not know that at all. So however you can, you find out things that the client likes and they're going to see as positive outcomes. Client involvement in activities needs to be enjoyable, or at least not drudgery, at least not something you're having to just drag. It needs to be something that now, that's an example I want to bring up there, and I think I talked about it before. In the drug and alcohol rehabilitation settings, that is where I have seen it the most. When I was there doing some work, when they would come in, you would have new patients come into the facility for rehabilitation. When they first got there, they did not want to look at you. They didn't want you coming in their room. They didn't want anybody fooling with them. But is that why they're there? To be left alone? No. Once you are motivated as a patient to come on that first time, if you can get them to enjoy and see that there was benefit in the reason that they came, the next time you show up to their door and say, hey, we're going to start activity in 10 minutes, they're probably going to get moving if they truly enjoyed and saw benefit from doing what you did the first time. So that's important, that you want it to be something that they are going to enjoy. So something else that we need to look at when we are planning activities and programs for our clients are client characteristics, which are obviously just we need to know everything about them. You look at things like demographic characteristics like gender, age, socioeconomic status, family composition, ethnicity, education level, religious orientation. A lot of these things matter, and you need to know them. Financial condition. Those need to be considered while you're selecting or designing your program. So think about, education level. You need to know that. You don't want to take them. That was something I saw every day when I was at NMRC. Their education level was very low because they were in a facility for development of disabilities. So we had to adjust plans accordingly. We also, religious orientation. We take people as recreation therapists on trips and outings and things like that. Gosh, I don't know, and I'm not trying to be funny here, but if you had someone who comes in and they're Jewish, you probably don't want to take them to the pork chop festival. I mean, you see what I'm saying? Like, those are the type things that play into what we're talking about. And again, like I say, I kind of go over the top with examples, but maybe you'll remember the over the top examples when you get out of here. So one thing, your patients or your clients, they should be able to see carryover value in activity participation. So basically, they should feel not that they're just getting positive changes and positive interactions and help during the time that they're with you, but they see it as something that they want to continue, that they can go out of your activity therapy time and they're still going to see some carryover of benefits. That's the goal. That makes them come back for more when they see that they are doing better once they leave your care at that moment. Okay, resource factors. The number of clients to be included in the activity and the number of staff conducting the session have implications for the degree of difficulty of the activity selected and the safety concerns. So, if I was going to take a group of clients for a hike or just a walk around the NMRC campus, there's cameras everywhere. There are sidewalks and there's lights everywhere, and there's always staff and clients out and about. And I just have a group that I'm taking for a walk. How many staff would I need for something like that?
At least 2.
At least 2, absolutely. But would I need a bunch? No. If I was going to take a group to wrestling, what would my staff to client ratio need to be for something like that? Probably no more than 2 to 1 client to staff, where you could have a hand on them, because you get in there, I know this from personal experience, you get in there and you get started, you're trying to find your seat, and you know what they're probably going to do to you? Turn the lights off. Then what? You got people that are developmentally delayed, don't speak. You let one of them walk off from you, you have a problem. Just saying. So that's basically what this is getting to here. You need to think about, that's not necessarily a degree of difficulty situation, but it is a degree of supervision. You know, how much supervision do we need to have for taking a group to this place? I mean, if you were doing something, simple like arts and crafts, wouldn't take many staff to run a something like that, unless your clients needed a lot of assistance and a lot of guidance, but you could go from one to the next, and while you're away, the others can be doing it. If you were doing something physical, you may have to have, a semi-treacherous hike instead of on sidewalks. If you were going to take them up through the nature trail somewhere, you probably would need to have more staff than if you were just going on a regular walk. Just the kind of things to think about. For all programs, but especially for leisure education and skill development programs, consider adequate time to learn, practice, and enjoy parts of the skill. Don't rush your way through it. Don't, especially for leisure education and skill development, if you send somebody out, it's like I said, you wouldn't want to send somebody out onto a pickleball court at OPC without taking ample time for them to know some rules, how to hold the paddle. Don't rush them into it. Give adequate, ample time for them to know what's going on, and preferably take a little time to practice with them prior to them going the first time, because they're still going to be, what is my 7-year-old? Noobs? Yeah, my 7-year-old wants to call everybody a noob right now. I don't know why he thinks that's the coolest word, but okay. Too much equipment or lots of highly specialized equipment is going to detract from the focus on the treatment goal. You know how we all get distracted by shiny stuff? For lack of a, better way to put it, that's all this is getting to. If something is too, just too much, they're going to focus on, whoa, what? If I've seen it, I know that that's the case. Now, I'm not saying to use some old janky stuff that you could get better tools and better equipment, but you also need to not just focus on this. We talked about bowling with 2-liter bottles and water. Hey, you can get some good out of that. You're going to have laughs, you're going to have fun, you're working on hand-eye coordination, lots of different things, and you do not have highly specialized equipment that's going to detract from the focus on the treatment goal in a situation like that. So on that part, just like I said, shiny things make us get distracted. And I think that's basically across the board. So a lot of things that you do in recreation therapy, you're going to be using games. And the reason you may use a gaming format or style is you have the ability to induce change in the participant. You want to provide them stimulating experiences in a non-threatening environment. And when you're talking about games aren't a very threatening environment in general, if you think about it. So that's why you want to use a gaming format. You want to have some flexibility and relevance to real life situations. That's where we talk about at the end of a recreation therapy session, you do debriefing and you tell them, okay, we did this today, but I want you to think about when you go home, how does this apply? So you are relaying it in that point, the relevance. Look, we worked on you picking up cards with your right hand today because you have trouble with that hand. Do you think that's going to help you when it comes time to hold a fork and eat when you get home? I mean, try to tie it into something that they will use when they get home or away from your care. That's another thing that makes them buy into what you are telling them and doing with them. Group cohesiveness. What are we talking about there? What's another word? So there's a single word that comes to my mind when I think group. Teamwork. There you go. You want them to, I saw this big time in, both settings. Special Olympics, when I was coaching the Mississippi delegation for golf, our golf team, man, they were thick as thieves. You couldn't, if somebody messed with one of them, they would all jump. It was crazy. They buy into this team thing. You also, I saw in the drug and alcohol rehabilitation facility, I saw where when they would buy into this group cohesiveness and say, we're all in this together, we all need to participate if we're going to have good sessions, because a lot of times there you're talking in sessions and you're letting them express feelings maybe, and you know, what were some of the reasons why, you know, it's kind of like an AA meeting. You need people to be honest and outgoing, and by doing that, when everybody's doing it, you've got some cohesiveness and you've got a team that are all working together to try to get better. Now, is everybody going to always do that? No. You're going to have some people that are going to not buy into the program, and all you can do is keep trying. You know, that's all you can do. And realize that once they are discharged, that they're probably going to come back and you're going to see them again. Just matter of fact. Some people just, you're able to get to them, and some you're not. Depth of involvement. You want to make sure that what you're doing is interesting, an interesting format when you're coming up with games or activities, and that there's a clear purpose. They're going to buy more into it again. You want people to want to participate in what you're offering them. And by giving them a clear purpose and making it interesting, you're more likely to get them to do that. You have to look at level of motivation. Again, some patients, clients are going to be much more motivated than others. Some really want to get better. Some really are just there because a judge told them they had to go. And they're planning on going and doing the same things that they've always done when they leave. Now, you have a short time span with your patients, so you need to make sure that you're getting the most motivation into them as you can during the time that you have them. Receptiveness, what we're talking about here, as you get to know your patients, clients, and you work with them more and more, they are going to become more receptive to what you're telling them. They're going to listen more. They're going to believe you more. They're going to be more open to trying new things. They'll become less defensive. They'll be more open to constructive criticism. Would you want to try that the first day with a new client? Probably not most of the time. You want to build that rapport. You want to work with them a little bit. You want them to believe in what you're doing and start seeing some benefits before you really start giving them things like constructive criticism. Responsibility, they need to realize that in gaming formats, in games, that you all have, in soccer, you've got a goalie, and then you've got, a forward, and they have different jobs, right? They all have responsibilities. In different games and on teams, which is what you want your groups to become, if possible, everybody's going to have their own responsibilities. And they need to take responsibility for their lane, their actions of what they're doing, and realize that it affects everyone that's playing the game. Safe environment. One thing that you can do to help provide a safe environment, it's not necessarily all about location. It's not about having security on scene or anything like that. A lot of this has to do with the leisure education that you can do up front, where you teach them the proper way to do things up front. You see people in the gym that, now I see some funny videos where people are in there like flying up in the air, doing the different, but some people need that trainer to walk over and say, hey, you need to keep your elbows still when you're doing press downs, or whatever. They need somebody to give them that information. Not only will they see better results based on that constructive criticism, But it's going to be safer as well. You know, squats, what do they say on squats? You're supposed to, like, your knees go out forward and your butt goes down, right? You're not squatting down past 90 degrees and things like that. That's for safety purposes. And you get better results when you're doing things the proper way. So if you're working on games and activities for leisure education, this is talking about what can you do, what things are out there, how do we do it. There's some general rules and considerations for constructing games. You want to decide the overall purpose and the goal of the game or activity. You want them to know that there is a goal, that there is a purpose, and you may leave them hanging up front, like when you do the briefing at the start. Okay, this is what we're going to do. And we're going to, you know, pass the ball here and there, and you tell them exactly how the game works. And then you may say, there's a purpose to this. When we get done, I'm going to tell you why we did it. Okay? They need to know that there's purpose in what's going on. And I kind of like that, kind of rolling that way if I can. I don't like to tell them necessarily every time in a group, this is why we're doing this up front. I like to make them do it and then ask them questions. So, how do you feel after doing that? What do you think we just accomplished? How many of you feel different than you did at the start of that activity? What do you feel like you gained? And they answer their own questions and find out what the goal was. They'll tell you themselves. So you want to write specific intended participant objectives for outcomes related to participation in the activity. Okay, I've just made a decision. We're going to talk about objectives when we finish this slideshow right here before we go today. And we are almost done. And then next time we'll talk about chapter 4, and we'll probably go more into these objectives that we're going to talk about in a few minutes. You want to select the general format of the game or activity, develop the rules of the game. When you are laying that out, now there's no surprises in that, and those don't need to change. You need to give clear rules to a game up front, and that's part of the briefing process. That's where you give instructions. This is what we're doing. This is how we do it. Gather or create the necessary materials to play. Make sure that you have that beforehand. Again, you don't want to, it's just like having to read the instructions as you're learning to play a board game with them. You're wasting their time. They realize that you don't even know what you're doing. You know, have your stuff ready. Have what you need there in advance, and where you can get right into what you're doing. Play the game with other people, and then once you, now this is prior, this is you planning a game or an activity even that you want to do with your people. You want to select the format, you want to develop the rules. This is you coming up with something, not that you've just found, like you're working with a specific group. I want to make a game. You decide, you figure out the purpose, you figure out the objectives that you're going to try to do with this game. You select the format, basically how does it work? You need to give the game some rules. Make sure you have the materials you need. Then you want to play it with maybe, say, a coworker, spouse, your kids, somebody, and try it. See how it worked. And then you revise the game if necessary. You know, you might play it and be like, whew, that didn't work like I thought it was going to, which is not cool. But hey, at least you tried it on somebody else before you just went in there and had a group of people kind of lose, I don't know, not respect, but a little bit of, you're like, that wasn't any good. You know, you don't want that to happen. There are two approaches to therapeutic recreation: selecting activity based on client goals, and then there's selecting client goals based on activities. I'm not a subscriber to number 2. I am all about, I think that you need to select your activities based on client goals and what is best for them. That needs to be fit that direction. You don't say, well, we have a pool, so we're going to teach you to swim. We got a basketball goal, so we're going to work on dribbling with you. I mean, you need to think about where their deficits are and then look at what you have and give them things that, so base your activities on client goals, which you're going to help them to build. Y'all following me on that? I'm just telling you that from experience. This is all from the book and all. That second one, you can scratch through that as far as I'm concerned from what I have seen. All right, let's actually read through this summary because pretty short chapter, pretty short talk, all in all. Each program or activity needs to count. It needs to be planned with interventions and outcomes in mind. So make what you're doing worth doing. Have a reason for what you're doing. Important consideration includes purpose, client needs, client outcomes, a variety and requirements of activities, and facilitation techniques. That's just how you provide the activity or facilitation techniques. The factors that influence activity selection include activity content and process, the characteristics of your clients, and resource factors. Again, you don't want to plan nature hikes if you're in a facility, an inpatient care facility that doesn't have nature hikes available, or you don't have a way to transport clients to do nature hikes. How are you going to put that into their plan or their goal? So resource factors play in. Games and activities have many advantages for client involvement and for reaching client outcomes. They help them to, become more of a team player. It helps them to get more involved. A lot of times when you're playing games, when you think about playing like your favorite game or doing your favorite activity, when you are really doing that, are you thinking about other stuff? You're in it. You worried about exactly what's going on in that game at that moment. So if you provide them with a game or activity that they are truly enjoying, that's where their mind's going to be. They're not going to be worried about whether mama and daddy were fighting at home the day before. They're not going to be, they're going to put a lot of that stuff on the back burner. And what is that called when you get in that zone? Flow. There you go. Thank you. That's where we want to get people through what we're giving them. It's called the state of flow. And that's where basically everything else goes away. Your tunnel vision on exactly what you're working on. That's what it's all about. We went over the 7 rules or steps to designing kind of your own games or activities. That's a good slide to have and be able to refer back to when you think about trying to come up with an activity that's not pre-made. And a lot of times we have to do that depending on what's available to us and who we're working with. Sometimes we have to come up with our own ideas, and that's not a bad thing. There's a number of resources available to help provide intervention activities and games to clients of therapeutic recreation services. And that will be it for that one. So I'm going to stop the share, and I'm going to go back here, and I'm going to get out of this, and I'm going to go here. Sorry, feeling my way through this little part. I'm trying to see if I have this. And we're going to pull this up. And I'm going to go back to the Zoom. I'm going to share my screen again. And we're going to share this. Now, for those of you who end up watching this, you can take a few minutes and look at it now because I'm about to give the class a hard copy of this paper. This stuff right here is very, very important to proper therapeutic recreation. Now, obviously, this is also on the blackboard because I pulled it up. I went ahead and had some copies already. Sorry. Thank you. All right, we're not going to spend just a ton of time on this, but we're going to talk about this because this is something that you're going to work into as we get a little deeper into the semester, and there's going to be some things where I need to see that you are able to write these in the proper format, okay? So to circle back around, when we're talking about providing activities for recreation therapy, once we've gone through the assessment, we need to come up with two things. What are they? After we've done our assessment and we get to the planning phase, we need to come up with two specific things for our client. Goals and objectives. Thank you. That's it. So, goals are what? Big picture. Improve cardiovascular health. Improve hand-eye coordination. It's going to be something very simple and broad, okay? Objectives are going to have three things involved in your objectives, and they're all important. And they're all listed here on this sheet. So every objective that you write, your objectives are going to be, you know, let me see here. Let's look at the top one. We're looking at an objective here. I'm gonna give you a goal. And let's say, okay, this is Carrie, is her name. Her goal will be Carrie will become more independent in self-care. Okay? Simple, broad, we're not naming a bunch of stuff. This is saying that she's going to be able to do more things on her own without assistance. So then we look at an objective that fits that. This top one up here, number one, we're talking about Carrie. And you need to make a note on this, you need to circle them, you need to put a star. Every objective is going to have a condition, a behavior, and a criteria. If I ask you guys to write me objectives down the road, and I will, and they don't have a definitive condition, behavior, and criteria, then they're not going to be proper objectives, and I won't be able to give you full credit. And I really want to give you all full credit, and I really want you all to know how to write these properly. So the condition is basically, when is it going to happen? Okay? What causes the activity to occur? So the condition for this first one is going to be, when prompted by staff to bring her basket of dirty laundry to the washroom. That's you can knock that down even to when prompted, comma, but you know the rest of it being there makes it a lot more clear. When prompted to bring her basket of dirty laundry to the washroom, behavior. Carrie will wash her clothes in the washing machine following the steps of her task analysis, which you've gone over with that, and you would have that in paperwork. This is what has to, you have to open the door, you have to put in the soap, you have to put in 75 cents, or whatever. You have to give a list of how it's going to be done and practice that with her. So she's going to know that's her behavior. So condition, when prompted to bring her basket, she will wash her clothes following the steps of the task analysis. And the criteria, now this one is very important, and this one gets left out a lot and people don't really understand. The point of the criteria, when we write goals and objectives for our patients or clients, they need to be things that are measurable, things that you can hold a clipboard and say they did it or they did not do it, okay? Criteria are the things that make it that way. She will wash her clothes in the washing machine following the steps of the task analysis. 8 out of 10 steps of the task analysis independently, 1 time per week for 1 month. That is measurable. That is trackable. Understand the 3 parts on that. So, let's go to number 2. And we're talking about Matt here. When verbally presented by staff to choose between 2 activities in the community, such as bowling, movies, or shopping, okay, Matt, your behavior, he's going to select one activity and begin within 15 minutes of arriving to the location. Criteria, trying the activity for at least 30 minutes with less than 2 prompts from staff to remain with the activity for 5 total activities. Measurable, trackable. What would, anybody think of what might be a good goal that would go with number 2? Matt will improve his ability to make independent choices, better decisions, definitive decisions. Apparently, this is a case where you are getting him to choose. You want him to choose, so he must have an issue with picking things. You ask him what he wants to do, and he's just like, I don't know. He would just stand there forever, not making a decision. So this is something to work on him being able to make definitive decisions. And then once he gets there, he's going to stick to the decision he makes. Try it for at least 30 minutes with less than 2 prompts from staff. So you don't need to be constantly on him like, hey, keep bowling. Keep bowling. If you're doing that, did he get his check mark for that day? Nope. He may have met the condition. He might have made his choice. He might have selected one, and he might have began within 15 minutes, but if he didn't do the other, he didn't fully meet his objective. And that would be in the notes that you would make that had to do with it. Let's do these other 2. They won't take long. We're going to talk about Mary and Nathan. So, Mary is probably a client at the North Mississippi Regional Center because she has problems with inappropriate behaviors, as we're about to see. And so, the condition, when in the community, for example, visiting the mall at a restaurant, and it's getting crowded and noisy. So basically, most all of these you can really narrow down to 3 or 4 words. when in the community and it's getting noisy, Mary will ask to find somewhere quiet and take a break instead of yelling or hitting staff. Sounds funny? It happens, I promise. 4 out of 5 visits into the community for 2 months. Trackable, measurable. You've got to give numbers and the criteria. You know, it's good to say, you can even use percentages. She will do this 80% of the time over a 2-month span. That's 8 out of 10. You know, you're just using a percentage instead. So what would be a good goal for that? She has trouble with inappropriate behaviors. Mary will work on communicating her needs in a more, on more clearly communicating her needs would be a very good, concise goal. Everybody following here, like where we're getting the goals based on the objectives? And you see the clear 3 things. If I wrote down an objective, would you be able to label the condition, the behavior, and the criteria? Maybe. That's kind of where I'm wanting you to get, because I know this is kind of overkill a little bit, but it's really not. And I want you to keep this because we're going to use this. And this is stuff that you will use in the field. If you end up doing recreation therapy, you will write objectives and you will write goals. Okay? And this is the format that they really should be. Lastly, let's talk about Nathan. With staff assistants, that's right there is kind of your condition. He has to have staff assistants. With staff assistants, after creating a resume and setting up an interview with at least one potential employer, so he's got staff assistants and he has set up an interview. It's basically a 2-part condition here, and that can be that way. Nathan will practice for the interview by verbally answering mock questions from staff. Very clear behavior that he's doing. He's going to do mock interviews for at least 15 minutes per potential job every other day until the job interview. I like that. 15 minutes. You can set a timer on that. You can say whether or not he did it. You can keep up with it per job every other day. That's easy to do. You know, you don't want him to do it necessarily every day. Give him time in between until the job interview, and that's when that one would end. You've got an end point on that particular one. Any questions, thoughts? Hang on. Somebody give me a goal for Nathan. One more time. That would be very good. We'll improve his public speaking / interview skills even. Nathan will improve his chances of getting a job in the community. I mean, you're right on track with what you said too. There's just several different things and they're all pretty broad. And this particular objective, now, one thing to remember, when you have a goal, these broad goals, you're not just going to have one objective. Usually you're going to have 2 or 3 objectives minimum that are going to, different things that are going to help reach that goal. Okay, y'all good? Everybody, any questions, any thoughts, anything like that? I'm kind of glad that we went on and got into that today because I want y'all to be getting that stuck in your brains. We will, we're going to talk about chapter 4 next class. We may go back over this. I may give you an example. I have a feeling that may happen. It may work like a quiz or something. So you may want to, between this time and next class, kind of look this stuff over, be able to find condition, behavior, and criteria, be able to write a a behavior, an objective that goes with a goal that I give you or something like that. Or I may give you just, the hypothetical case study, like I said, and tell you, give me 2 goals with 2 objectives for each. So look back over this stuff and remember that goals are broad, objectives are the small steps to get you there. Good job today. Thank you guys for your attention. See you on, what day is it today? See you on Tuesday. Y'all have a good weekend. If you can't tell, I like goals and objectives. I don't know. They get me excited. What's the what? Hang on, let me turn off my camera. I'm still recording over here.